For years, measles was considered a disease that the world had learned to control. A simple 2-dose vaccine had turned what was once a deadly childhood threat into a preventable illness. Many countries even declared the virus as eliminated, marking one of modern public health's greatest achievements. But in 2026, that sense of safety is now beginning to collapse. From the United States to Mexico and now across South Asia, measles is making a deadly comeback. It is exposing the cost of falling vaccination rates, overburdened health systems, and growing gaps in public health coverage. It began quietly in Mexico. A 9-year-old boy visited relatives in Seminole, Texas. When the child returned home to Mexico, he developed a red rash, and within weeks, classmates started falling sick, schools were shut down, and the virus had already crossed borders. The small town in America soon became the epicenter of the largest measles outbreak in the United States in more than 3 decades. Mexico has now recorded more than 17,000 confirmed measles cases since the start of 2025, with at least 40 deaths linked to complications. These deaths include babies and farm workers. And most of the people who have been infected were unvaccinated. Health authorities say that the outbreak first spread through a remote Mennonite community in Chihuahua state before moving into agricultural labor networks and indigenous communities. By the end of 2025, the Chihuahua alone reported more measles cases than the entire United States. Experts warn this is what happens when immunization coverage begins to slip. Remember, measles is one of the most contagious viruses known to science. It essentially spreads through coughing, sneezing, or even talking, and the virus can remain in the air for up to 2 hours. One infected person can potentially spread it to 18 others. In young children, the consequences can be devastating, and they may vary from pneumonia to brain swelling. The crisis is now expanding far beyond North America. Bangladesh is currently facing its deadliest measles outbreak in decades. Authorities have reported 459 child deaths since mid-March of 2026, along with thousands of confirmed cases and tens of thousands of suspected infections. Globally, 82 countries have achieved or maintained official measles elimination status. But health experts say that the status remains fragile. Recently, the virus has been making inroads in the Americas, with the US and Canada losing its measles-free status following prolonged outbreaks.